Very good evening, friends. Meeting again in the session of Stuart Close philosophy, and we are discussing new chapter from Stuart Close philosophy. That is the examination of the patient. Most practical aspect which is necessary to learn from for every homeopath as well as every homeopathic student. And here, Stuart Close has tried his level best to explain how to look towards this topic. First important thing he has highlighted that you must know prior to the case taking that what you want to ask and what is the purpose of it. If you know the things, then you are going to look towards it. If you don't know, you cannot. That is a big important thing which he has explained to start with the chapter. And then he explained exactly what is needed from your point of view, from homeopathic point of view. What is the need? Is it a diagnostic? You are doing the case taking for the diagnostic purpose or therapeutic purpose? If you are doing it for the diagnostic purpose, then if it is for the diagnostic purpose, then specifically, though it depends upon common symptoms. If it is for the therapeutic purpose, the totality which you get or gather together on the basis of common symptoms is not at all useful. You cannot prescribe a remedy. You cannot come to the conclusion. And that's why it is too much important to know the characteristic totality of the case. And for therapeutic totality, your totality of symptoms must be characteristic enough so that you can catch exactly the important symptoms, the individuality of the patient. And if you know prior to it, then and then you can go ahead. And that's why he has explained. I have taken the chapter of symptomatology first and then the examination of the patient, because you must know what is important for your point of view and to which you must give the importance. And that's what we have discussed in last time. We are on page number 168. We have finished the last paragraph. We have to start right from. Let not the pathologist, therefore, criticize the methods or findings of the prescriber, nor the diagnostician assume that his findings are sufficient for the materia medicis, but let each regard these matters in the spirit and from standpoint of physician. For the physician, as an ideal, is greater than any medical specialty. The specialties in medicine only exist in order that by combining them, the ideal of perfect physician may not die and disappear from among men. However, doubtful we may be of necessity or real value of the result. It is true that in the vast extension of so-called medical science, it has become impossible for any one man to grasp and master it all. Therefore, medicine has been divided into so many specialties that we know. We might paraphrase the old proverb, it takes 9 tailors to make a man, into a new medical proverb, it takes 9 specialists to make a physician. Very nicely he has elaborated over here. If you go with the modern science, there are different branches. There is a branch of cardiologist separately, the gastroenterologist separately, neurologist separately. Again, there are super specialists, specialities over there. So every branch they have divided it only for the purpose of making more study about that specific branch. Considering that it will help in order to understand the human being. And because of which it has happened that the person who used to look toward the neurology knows only regarding neurology. He never looked toward the cardiology. He never looks toward the rest of the systems. Actually, the purpose was that it is not so simple to grasp each and everything, and that's why if we make different groups, it will be possible that everyone will study their part and then they unite together and then they will treat the patient. But what has happened? You have divided the human being into different parts. And everyone was concentrating on that specific part and concentrating over the local causes of the diseases or local pathologies over there. If you want to, if there is a gangrene to the tip of the finger, the line of treatment considers that it is the gangrene because of which the person is deceased and remove the gangrene, that is the treatment. But from homeopathic point of view, if you look towards it, you know that it is the human who is deceased because of which he has a gangrene. Treat the human, the gangrene will be settled. See, the concepts varies, and as the concepts varies, that's why the line of treatment varies. The local treatment, if you remove that gangrene by local means, it will increase towards the major organ, or it will go towards the from periphery to the center. But if you treat the center, the peripheral part automatically will going to settle. And these concepts one must know. And for that purpose, it is so much necessary to understand the importance of all those branches. But from that, you only grasp what is the pathology, not more than that. I will let you know the very simple example. When I was student, I was in final year. In fact, final year or internship was going on. And at that time, it's period of 1989-90. My father, he's a doctor. He himself had a very severe cramps in lower extremities during sleep. It has started nearly about 2-3 months before that. And daily he used to get very severe cramp. He used to wake up and cries during sleep, and it was so painful. And then after 1 or 1.5 hours, it gets released. That was his problem. He was seen by physician over here who has started him on calcium tablets. Then someone have suggested vitamin E. Then he has seen by senior surgeon over here. He has asked him to do potassium levels. It was normal. Still he has given the potasol, etc. But it was not getting settled. Ultimately, this referred that you must go to the neurologist. So he came to Pune, and we met the one of the neurologists from the Ruby Hall. And he had checked him, and he said that you do EMG nerve conduction study. EMG nerve conduction study was normal. Then he said nothing can be done. Whatever is going on, calcium and etc. That's all. That is what we have to give, and we can give. Then my father asked him, what's your diagnosis? He said, this is called as nocturnal cramps. See, he was getting the cramps at night. He has labeled it with the nocturnal cramps. What is the use of giving the name or labeling it with certain name? Nothing. Because treatment was not in their hand. Nothing was working. Everything was going on. Then I considered his modalities. I considered the problem, and I have prescribed him directly a Cupramet. Being a student, I was not ready to prescribe, but at that time I have tried, yes, let us do what happens with Cupramet, and I have given 3 doses of Cupramet at that time. The day he has received Cupramet, his cramp stopped, and till today, 1989, till today, he never had that problem again. So what is important? You must know what is characteristic and what is common. If you look towards common, you will not going to get any remedy. But if you look towards the characteristic and pick that from the case and you prescribe, that will be beneficial for the patient's point of view. So in the examination of the case, what is important that you have to catch? What is the important and which will guide you towards the therapeutic purpose that you have to bring towards one end, and you have to look towards certain symptoms which will give the diagnosis that will be useful only for the purpose of knowing what his disease is, because of which you will understand the pathophysiology of the disease, because of which you are going to understand the complications which can develop thereafter or prognosis thereafter. For that purpose, it is useful, but not for the therapeutic purpose. And this is what he wants to differentiate over there. The general practitioner, if one dare to follow that ancient and honorable calling, must act in several capacities. as a hygienist, sanitarian, pathologist, psychiatrist, diagnostician, therapist, and perhaps even surgeon and obstetrician. But in each of these departments, he may be compelled to fill up the measure of his own technical shortcomings by recourse to the specialist. See, very nicely he has explained that there was a concept of general practitioners previously. What was that general practitioner's concept? The general practitioner, who was the family physician, used to treat every individual from that family, and he was knowing that what is the problem with the patient. He was dealing with all complaints of the patient. Unless and until he feels there is need to take the help of specialist, he never used to refer to them. He used to treat his psyche, he used to treat his mind, he used to treat his physique, he used to treat everything, even dental pain he used to treat. There was no dentist previously, but they used to treat the even dental problem. And people used to get very easily settled after taking the medicine. Because he was the person who was considering the whole human being. He was considering not only the person, that individual, but all the persons in the family. And that's why it was quite easy to catch that. And he was the better person to know that individual as a whole. He is the wise physician who recognizes his own personal and technical limitations and judiciously uses the services of the others who are specially qualified in some particular branch. And he is the wise specialist who recognizes his limitations, who realizes that after all, no matter how expert he may be in his branch, he is only, as it were, a part of physician in the broad sense of the word. Modesty pays good dividends in long run. And he was the person, he was knowing his limitation. He was the person who used to understand, yes, this fellow, where he should take the treatment, to whom he can refer, or who will going to understand the patient's complaints and treat. And he used to person who used to refer to a proper man. Because he was the person who was knowing each and everything about the patient as well as patient's family. That was a good concept. But with the time, this has vanished. Now there are very few general practitioners remain. Even it has happened that the things have changed from every specialist, he is practicing general practice now. This is how the changes have been happened. And people are not understanding the importance of general practice, and because of which they are suffering from the drug diseases, more investigations, etc. And this is what he wants to highlight over there. In this spirit, we may all cooperate for the best interest of our profession and our patient. And I agree with Hahnemann in the postulate of the first paragraph of the Organon. The highest and only mission of the physician is to heal the sick. Every medical specialty is subordinate to that ideal. The work of homeopathic prescriber, dealing specifically as it does with the application of medicines to disease according to a definite principle for the purpose of curing such conditions as are amenable to medicines, but must ever remain one of the most important functions fulfilled by the physician. Although the related branches of medicine, hygiene, prophylaxis, sanitation, surgery, physical therapies, etc., have made great strides, and the time is yet far distant when pharmacotherapeutics will become unnecessary. So, the things are explained by Hahnemann in first aphorism. The high and only mission of the physician is to restore the sick to health, to cure as it is termed. And that is the main aim of every physician, that he should go for the cure, again bringing back the original state of health. And you have to take into consideration all those things. It is not just prescribing medicine for the patient. Homeopath should be a person who is going to look towards all those things. Yes, prime aim is to give the medicine if it is needed. If the patient comes to you with an acute something problem, It is your duty to treat him as early as possible. But if he is having the cholera, he has explained in last chapter, if the patient is having the cholera, you must treat that cholera, but at the same time, your role as a physician starts. And then you have to look towards all other branches. You have to tell the importance of hygiene to that patient. You have to run behind prophylaxis from the rest of the members of the family. You have to tell them importance of sanitation. Then if necessary, whenever in cases surgery or physical therapeutics, means the um, physiotherapy, all those things are important. It is not only just prescribing in homeopathy. You have to look towards each and every point. You are not just a homeopath, it is a homeopathic physician who should have knowledge about all those things, and which is useful in order to tackle all varieties of cases, whether they might be acute or whether they might be chronic. It is your duty to treat them, and that's what he is explaining over there. And that's why the importance of examination of the patient plays a very, very vital role in order to understand this. It follows that pharmacotherapist must be a specialist in the sense of becoming an expert in his department, and this, let it be said, is the crying need of the profession. So a person who must have knowledge of medicines at the at the same time, how to prescribe, in what way it should be prescribed, in whether to give single dose, whether to repeat it, whether not to repeat it, uh, everything he must know. All aspects about the therapeutics, he must know properly. That is the need of the profession. If you know it, then you can prescribe. If you don't know it, it cannot. You cannot. With the diagnostic and pathological examinations and symptoms, as such, this article has nothing to do except to show their general relation to the homeopathic prescribing. The purpose of this article is to teach the principles of case taking and how to determine from the record of the examination of the case what symptoms are most useful as indications for the curative medicine under the homeopathic principle. So he is explaining here the question. This article is not for the purpose of just how to make a diagnosis and etc. Because diagnosis is not important for you for the prescription. The purpose of this article is there to what is important from the examination of point of view, which will help you to reach to the right simillimum. Exactly what one should look for. Exactly what types of symptoms will carry a more marks or more weightage in the case taking, and which will help you to individually find it out a remedy. And that is the purpose of this specific article. Some points on the method of conducting examination in such a manner as to discover and develop these symptoms for the use of prescribing will now be presented. So now he starts where exactly one should look for. So he explains some points on the method of conducting an examination in such manner as to discover and develop these symptoms for use in prescribing will now be presented. And he starts now to look towards which are the symptoms which are very, very useful for your point of view. In the present state of science of pharmacotherapeutics and with our materia medica, in its present form, most important thing to be remembered in examining patient for the homeopathic prescription is that with very few exceptions, the most valuable indications for the remedy are to be found. Number one, in those subjective morbid sensations and phenomena which come within the sphere of patient's own experience and are perceptible to him alone. So he starts explaining which are the symptoms which will be very much useful to you. And he adds over there, the most important in the case are the symptoms which are felt by the patient and which are having a subjective nature, that means which are not observable symptoms and which patient expresses in his own way. The very expressions of using those expressing those symptoms are very essential to individualize the remedy. to individualize the case. And those symptoms carries a full marks or much weightage in specifically in homeopathic practice. So first point which he mentioned, the subjective morbid conditions or sensations. Number 1 point. Number 2, in those objective signs of the disease which are perceptible to unaided and natural senses of ourselves, the patients and others. And then important are the objective signs. But objectives will are not going to give individuality more commonly. Very occasionally you get the individuality with the objectives. With subjectives, it becomes rather simple to catch a remedy. For first, means for subjective, we must, of course, depends entirely upon statements of the patient himself. The findings of the thermometer, the stethoscope, the microscope, and the various other diagnostic instruments gives us little, very little, as it that is directly available for the selection of remedy. The principal value is in determining diagnosis and pathology of the case, as bearing upon the prognosis and general auxiliary treatment. They also point out or more accurately define the anatomical basis of prescription and aid us in correctively localizing symptoms. So what he is explaining? For the first, we must, of course, depend entirely upon statements of the patient himself. What sentence patient uses? The statements. Because that gives individuality. The patient enters in your clinic and he expresses something. He starts the case. He enters and he starts. He enters all of a sudden, opening your door fast. Doctor, shall I come? May I come? Already he has entered. And he is in agony. That is what is important for your point of view. You have to find it out. What's wrong with the patient? Why he is so abrupt? Why he is so expresses his all complaints? Why he is in agony? You have to think, because these are the things which gives the individuality of that specific patient. You have to look for them, which will guide you to find it out a right remedy in the case. And this is what he is explaining over there, that these, what the patient statements are there, they are important. And then second, the findings of thermometer, stethoscope, microscope, and other diagnostic entities, they are not so much useful to find it out a right remedy. You cannot get a right remedy on the basis of blood pressure. Yes, blood pressure increase. You cannot reach to the remedy. If the patient is having anemia, you cannot reach to the right remedy on the basis of anemia. If you get patient, many diagnostic investigations have been done and found to be that there is an increase, there is an increased WBC. You cannot come directly to the remedy on the basis of that. Those are things which will guide you to find it out diagnosis, and that diagnosis is useful to know what type of disorder the person is having, but it will not give you, help you in the selection of remedy. Their principal value is in determining diagnosis and pathology of the case as bearing upon prognosis and general auxiliary treatment. Yes, your auxiliary treatment can depend upon it. You can claim the prognosis on the basis of that. All those things are essential, but you cannot directly get exactly the right remedy on. They also point out and more accurately define the anatomical basis of prescription and aid us in correcting localizing symptoms. So if you know that there is a pain in right iliac fossa, and if you diagnose he is having appendicitis, you can localize, this patient is having appendicitis. If you know that patient is having appendicitis, you know that what are the complications he may land into, and which will create the problem for the patient future. And that's why how cautious you should be while treating all those disorder, and how much time and you have to give to the patient, how much importance there is in diagnosis. All those things, yes, definitely it is useful, but knowing that patient is having appendicitis, you cannot prescribe. And this is difference one must know. Our prescription depends upon individual features. On our prescription depends upon characteristic totality and not upon the diagnostic features. So we'll stop over here. Tomorrow we'll continue with the rest of the things in this chapter. And today evening we're going to learn one more remedy from B series, that is bromium, in today's session. So that's all for today. Thanks a lot, and meet at 8 o'clock with the bromium. Okay. Thank you.
Hello, sir.
Hmm?
Sir, I want to ask one question.
Hmm.
Can we use cocculus as a specific for car sickness? And what should be the potency?
Yes, cocculus is generally used for car sickness as a preventive, not for curative
Yes.
purpose. You can give 200, cocculus 200, one dose one day before traveling and same day of traveling.
Okay.
Yes, many times it helps in car sickness.
Okay, sir. Thank you.
So thanks a lot. We'll meet at 8 o'clock.